Assalamu alaikum all of you. Welcome to the second session on the Bloom taxonomy. In the previous session, we discussed about the learning objectives. What is learning objectives? What are the characteristics of learning objectives? What are the advantages of learning objectives for both the teachers and student? Then we discussed the Bloom taxonomy, the cognitive domain, um, the sixth sub-level, or we can say that the sixth level of the Bloom taxonomy, shortly known as the C1, C2 up to C6. We talk about the revised classification of the Bloom taxonomy, which is known as the modified or the revised Bloom taxonomy, and discuss the changes between the old version and the new version. Then we discuss the action verb of each level of the Bloom taxonomy, as well as taking an example of Apple to for the each to discuss each level, and for example of the remembering, and then the understanding, and then the applying, analyzing, and evaluating, and the last one, the creating. We discussed the revised version of the Bloom taxonomy in this discussion, just because nowadays this one is used, the creating is the last one, while it was the second one below the evaluating in the old version. So that is our this session topic. We will just discuss some questions and activities of related to the cognitive domain, just for the more in-depth and the detailed understanding of this Bloom taxonomy. Though these examples, these questions and these activities, they are not related to that medical sciences, but they are just just for example, and just for the understanding of these different levels of the cognitive domain on the Bloom taxonomy. So example question for the remembering that maybe what happened after, how many, who was it that, can you name the, describe what happened at, who spoke to, can you tell why, find the meaning of what is and what is true or false. If we look at these questions, all of them, they are just recalling the previous facts and knowledge the students would have in their brain. If they are unknown to the fact, so they will be unable to answer this question. But if they are known to these questions, then they will move to the next level, which is actually the understanding or comprehension in the old version. So activities of this easy, simple, and low level of learning, the start level of learning, that is the remembering, that is make a list of the main events, make a timetable of events, make a fact chart, make a list of any pieces of information you can remember, just all in the story, article, reading piece, make a chart show. So again, these are just based on simple question and based on the previous knowledge and fact that will have in the brain. I will just read out these questions. And understanding the questions maybe like, can you write in your own words? Now, this is something more detailed of the previous knowledge. If they are known to the fact, they will explain them, they will elaborate them, they will write something new, which will be more explanation, more description of the just simple facts. So can you write in your own words? Can you write a brief outline? What do you think could have happened next? Who do you think? What was the main idea? What was the key character? Can you distinguish them? What differences exist between? Can you provide an example of what you mean? Can you provide a definition for? So it means all of these questions, if you look at these questions, they have a little bit more knowledge, they have a bit more complexity than the previous remembering one. So if a student is expert, if a student is master at the remembering level, then they should move to the understanding. But if they don't know about the concept, about they don't know about a phenomena, so how they will write in your own words? So that's why Bloom termed this concept as the master learning, that they should be master at one level and then they will move to the next level. Activities for the second level of learning in the cognitive domain, That would be like illustrate what you think the main idea was, make a cartoon strip showing the sequence of events, write and perform a play based on the story, retell the story in your words, paint a picture of some aspect you like, write a summary report of an event, prepare a flowchart to illustrate the sequence of events. All these activities, they have some more description and elaboration than the previous activities which we discussed for the memory. This is the level 3 in which they will use the previous knowledge and the previous understanding of a concept for a problem or in a critical situation. This situation may be very simple situation. There will be not very complex situation. For complex situation, they will go for the breakdown of all the components, and then they will read together in a new way to have a solution for the new problem. So if someone is expert and master at 2 levels, so then they can answer a specific question, a specific problem, like example question for the applying maybe. Do you know another instance where could this have happened in? Can you group by characteristics such as what factors would you change if? Can you apply the method used to some experience of your own? Now, if we look at these questions, all of them, they have new situation than the previous one, but that is familiar to the previous one, and they will use the level 1 and level 2 learning to have an answer to cope with this new situation, which is not different, but it's new for them. Sample activities for the level 3, they would be like construct a model to demonstrate how it will work, make a scrapbook about the areas of study, take a collection of photographs and to demonstrate a particular point, design a market strategy for your product using a known strategy. Level 4, analyzing example question. And level 4, as we discussed earlier, the student have to break down all the information into component, and they have to study separately the various components, and they will go in detail of this each and every component. Which events could have happened? How was this similar to? What was the underlying theme of? What do you see as other possible outcomes? Why did change occur, and so on? If you look at these questions, in all these questions, they have to compare, they have to contrast, they have to distinguish between two things, they have to compare between two things, and all they have a solution, 2 3 solution, and they will decide which one is more better, which one is the correct one, uh, which two are similar, which two are different. So they will just find out the contradiction between 2 solutions. They will just check the contrast between 2 solutions. They will just check the similarities between 2 concepts, and they will just go in depth and will discuss what is the difference between these two and what is the similarity between these two. So then they will decide which one is more better. So they will just compare, contrast, and distinguish between 2 or more than 2 concepts, and this is actually analyzing. The sample activities for this level, higher level, it is level 4, that is design a questionnaire to gather information. Now for that information which he is or she is going to collect it for their research work, for their survey, they would have familiarity with those terms and terminologies and that condition and that concept which regarding which they are going to collect the data. So in other activities like in this level 4, maybe write a commercial to sell a new product. Now he is already an experience of writing commercial for the products, but now there is a new product, so he has to use the previous solutions and the previous knowledge, the previous understanding to write the new commercials. So he would now he is known to the different steps, that what are the different steps and what should be there in a best and effective commercial. Another activity for analyzing is conduct an investigation to produce information to support AV. Make a flowchart to show the critical stages. So he is known to the critical stages, but now he will demonstrate all the critical stages in a flowchart. Construct a graph to illustrate selected information, and now he is known to the information, he has collected the information, but now he is just to illustrate them graphically in a suppose bar chart, or we can set the histogram or pie chart, just to for the clear demonstration. So make a family tree showing the relationship. Again, in this type of activity, he is known to the all concepts and phenomena there, and he is known to that what is the similarities and what is the difference. So he will just having connections, a link between two different concepts. He will just deviate from one because that is not similar to the other one. So he will just interconnecting and just kind of linking different concepts which are similar to each other. So he will have the capability of uh, showing that relationship between two or more than two concepts or phenomena. Prepare a report about the area of study. The second last level of cognitive domain is the evaluating, in which he have the capability to judge a situation, to have the values of that situation, and then read the situation, and then based on his previous knowledge and previous learning, he should have the capacity to deal with this situation. The example of question for this level that might be: is there a better solution to judge the value of? Can you define your position about? Do you think is a good or a bad thing? How would you have handled? What changes to would you recommend? Do you believe? Are you a person? How would you feel if and how effective you are? If we look at these questions, all of them they are very high level, and you can ask such questions from those students who are at higher level of their education, who have already studied a lot, who have already learned a lot about that concept and phenomena. Because if we look at here, all of them they need a very critical thinking uh, for this solution. So they have to understand the situation. They are new to the situation, but they have the experience of such situations. So if he have the situation and already tackled down a lot of such situation, then he will be able to tackle this new situation, which may have some minor modification than the previous one. And this is actually the evaluating step, in which he has to identify that what is that minor modification in the previous, what is that difference between this situation and how it is different from the previous situations. So if he has expert at the analyzing, in which he have to break down the information into components, then he will be able to evaluate the situation. Sample activities which are related to this level, that might be conduct a debate about an issue of special interest, make a booklet about 5 rules you see as important, convince others, important for convincing others, form a panel to discuss views, learning at school, write a letter to advising on changes needed at, write a report, and prepare a case to present your view about. Again, all these activities, they are based on a high level of learning, and a person who is able to doing this will be of high level of education, or we can say that he will have a lot of experience with such concepts and phenomena. The last level of learning in the cognitive domain is the creating, in which the students they will be able, in which the implies, in which the doctors, in which the physician and therapist, they will be able to formulate a new protocol, to formulate a new solution, as this situation is very changed from the previous one. There is some modification, might be there, might be minor modification, but or major modification, but this is quite different from the previous one. But he will be able to cope this effectively, and if he can handle it, mean he have learned the highest level of learning, and that is the creating. So example of question which can be regarding this last level of learning, that might be like, can you see a possible solution to, if you had access to all resources, how would you deal with, what would happen if, can you create a new and unusual use for, can you write a new recipe for a tasty dish, or can you develop a proposal which would. If we look at these questions, such questions, they are usually asked by the professor during a round, during that study discussion, study case discussion uh, from their trainees, from their students, from the TMOs, and there will be a situation, and then if they have known to the such cases, if they are, if the case is relevant to them, so they will readily answer that question. But might be they are unknown to this situation, might be they have no experience of such cases, so they will be unable to answer these questions. Activities which can be at this highest level, the that is the level 6, creating of the cognitive domain, they might be like invent a machine to do a specific task, design a building to house your study, create a new product, give it name, and plan a marketing campaign. If we look at these activities, all of them indicate that the person who is working on such activity, he has been graduated for all the required qualification, and now he is able to do new things in that field, write about your feeling in relation to, and so on. So these were just examples of some questions as well as some activities which were relevant to the different levels of learning of cognitive domain. We start from the that remembering, then understanding, then application, and after that analyzing, and then evaluating, and the last we discussed the creating. So as a final example, let's take a look at a step questioning activity in which a series of questions are asked. Here, there is a simple question for all the levels. Uh, the question one for the remembering, there would be like, what can you remember about the story? He have read a story, and then a question is just asked to recall something from that story. So what can you remember about the story? A little bit more complexity in this question would be like, summarize the story in your own words. Now the answer will be not exactly present in the story which he read, but he have to concise them. So obviously there is now a little bit complexity and difficulty in this answer. Another more complexity, if we add it to this question, that will be the applying, that will be suggest how the man lesson in this story could help other young people. Now he will use the concept, the lesson which is being discussed in the story, to be generalized to another situation. A more complexity if added to this at a much more higher level be like, why did the different characters in the story behave the way that they did? Now analyzing, he have to study the different characters. He has to study the components of each character, the characteristic of each character, the in depth of each character, and then he have to compare and contrast and distinguish, and just comparison between two or more two characters. So here the question will be like, why did the different characters in the story behave the way that that did? So for that he have to be known to all the in-depth characteristic of each character. A more complexity if added to this will be like, evaluate the strength of the main character's decision to leave. And the last level, rewrite the ending of this story to show different outcome. Now, if we look at now, the person has become a writer. He will write new thing which there is no just similar writing in the previous which he read, but he have or she have to write something new. So this is the end. And this is the last level of learning in which he is independently an expert of that activity. So now we will take a medical condition to have some questions and activities relevant to the this cognitive domain. So we will take 3 examples, and among these three, initially we'll discuss the hernia. So the level one, remembering the question, the activity might be like memorize, remember the anatomy, stages, types, treatment approaches of hernias. So that is just related to the basic medical sciences, the initial, just remembering. Level two, understand the pathophysiology, etiology, predisposing factors, complications, identification of treatment approaches of hernias. That is a little bit elaboration of what he have the um, facts about the hernia in his brain. Level three application, apply knowledge to diagnose, repair, or prevent complication of hernias. He should have to be known to the complication, then he is able to have some strategy to prevent these complication of hernias. Level four, analyze the diagnostic video of imaging. Now he, in the previous level three, he should have knowledge about what are the diagnostic procedure, what are the diagnostic options for the hernia. If he is known to all the options, now he have to compare among them which one is the gold standard, which one is the best diagnostic procedure to diagnose this condition. So for that, he has to go in depth to study the characteristic of each and the advantages and disadvantages of and the reliability and validity of each diagnostic tool. So he will obviously go for that which is more accurate, which is most valid, which having higher reliability. So which obviously the gold standard for that. So he will go for that. So for that he should have to be uh, discuss the each and every component of the different options of the diagnostic tools. So analyze the diagnostic video of imaging, different repair approaches. Now he have to be known to the different approaches, which one is the best approach, which has the best outcome. So that will be in the level 4. Recurrence in specific patient groups using the literature using the research. Level 5, evaluate. Now there may be some new situation. Uh, might be he have the experience of treating, managing, and preventing the complication in hernia cases, but there may be a patient who have some other condition, who is a comorbid, who has hernia as well as some other. So now what he will do? So he have to read, to understand, to judge this new situation, and then in the next step he have to provide some solution to this new and a complex situation. So level 5 evaluation, evaluate alternative hernia treatment options in complex situation such as inpatient with ascites, or approaches for unexpected findings such as malignancies. Now if the patient is with hernia but he have some new findings, unexpected finding, and that is malignancy, now what he will do? This is the evaluating and judging of this new situation. What he will do? He will be it is in the next, which is in the create, the level 6. Create a new approach to repair hernias, modify and mesh application placement, or handle unusual situation, like we discussed in the previous step, which is the evaluation. So this is the summarization of all the levels of the example of this hernia. And if we look at this pyramid, the remember is in the bottom. As we go at the top of this pyramid, the complexity, difficulty, and the level there is increase and enhancement in the all these parameters. So remember, this is just anatomy stages and treatment approaches to hernia, pathophysiology, and that indication and complication and the causes of these hernia, how to diagnose, how to prepare or prevent hernia complication. That is in the, you will use all these knowledge to answer such and to cope such situation. Analyze diagnostic video imaging, different repair approaches, which one is the best, which one is have more better outcome, which will give the better diagnostic video, and which will give the more accurate and reliable correct diagnosis. Then evaluate alternative hernia treatment options in patient with ascites and new approaches to hernia repair in such patients. So this is actually the cognitive domain and the at different levels. Another example is the subcutaneous abscess. So I have just to read that is just similar to the previous one. So in the level one, remember the definition, the clinical criteria, the description of an abscess. So there is no such complexity in this. There is just recalling of what he had to, and here just to recite what he have in the brain in the vocabulary. Level two, understand the etiology, physiology, evaluation, and clinical presentation of an abscess. Level three, apply knowledge to diagnose, confirm, and propose management of an abscess. Analyze knowledge such as the video of imaging or the evidence supporting the treatment approaches. Analysis is the critical appraisal of knowledge, and because uh, if he has known to the different approaches, but he can decide which one is the best, then he can use this in the new upcoming modified situation. Level 5, evaluate the validity and reliability of the information knowledge used to diagnose abscesses in various settings, such as the diabetic or the immunocompromised patient. What we mean by the validity and reliability? Validity mean uh, a tool mean जिस चीज के लिए इंटेंट हुआ है, यानी जिस चीज का इरादे से आप किसी काम कर रहे हो और आपने इरादा किया और आप उसके एक प्रोसीजर आप कर रहे हैं, तो क्या ये वाकई उस प्रोसीजर उसके लिए है जो आप करना चाह रहे हैं? So if then that will be a valid, and if there is a valid approach, obviously it will have a higher validity. Reliability means that there is consistency in the results. If suppose if there is a diagnostic approach, a diagnostic image, and every time when such patients are diagnosed with such a tool, so there will be an accurate and positive condition, positive answer will be, they will be true positive. But if there is unreliable imaging tools, it will give less true positive and there will be more false positives, or there may be false negatives as well. So it means this is in the evaluation. We have the knowledge of all approaches. We have the in-depth understanding of each and everything. Then we are able to do that evaluation and judging of that condition. And level 6, create new knowledge as in finding early diagnostic tests, less invasive treatment approaches. Now this is something new. He has to invent a new treatment where there is less invasion, all alternate tools for the intervention. So another example of the spondylolisthesis, which simply means the flipping of one vertebra over the another. Level one, memorize the definition, the classification, clinical criteria, and description of spondylolisthesis. What is grade 1, grade 2, grade 3, grade 4 spondylolisthesis? What are the classification based on the type 1, type 2, type 3, type 4, and type 5 spondylolisthesis? Similarly, he have to understand the etiology, physiology, evaluation, and clinical presentation of spondylolisthesis. What will be the signs and symptoms in a patient with spondylolisthesis? What will be the complication? What will be the problems a patient? What activities he will be unable to do with a person having spondylolisthesis? Level 3, apply knowledge to diagnose, confirm, and propose management of spondylolisthesis. Now the person will be able, he is known to the pathophysiology, so he will be able to decide that which tool is more accurate to identify. Either it is the CT scan, either it is the MRI, it is the X-ray, or something else. Analyze, which is level 4, analyze knowledge such as the value of imaging, the evidence supporting treatment approaches, and level 5, evaluation, the validity and reliability of the information used to diagnose spondylolisthesis and various settings such as the obese patient or elite soccer player. Now, there is something new situation which she don't have such experience previously, so he will initially have to read and then the judge and weighing this condition, and then he will use the previous earlier knowledge to cope with this new situation. And this is really level 6, the last, the higher level, the most complex level, in which she will be able to create new concepts, new phenomena, new approaches. So create new knowledge as in finding early diagnostic less invasive treatment approach and alternative tools for the intervention. These were the C1, C2, C3, up to C6, but we can also have a concise method of writing the learning objectives based on the this Bloom taxonomy cognitive domain, and this is the C1, C2, and C3. So if we are having a condition, suppose we have taken the example of that low back pain. So the anatomy, etiology, or we can say that each and everything relevant to that low back pain and the causing pathophysiologies, the anatomy, the structures which are being compromised here. So all these they will be in the C1. So here, if we look at these, mostly the understanding and the remembering, these two will be summarized as the C1. In the C2, given patient MRI interpret the most likely cause of the LBP, there will be C2, and C3, then there will be the higher level, keeping in view this case information provide diagnose the most likely diagnosis. We can also concise the different cognitive level, like there we can have C1 in the or remembering or recall, then we can concise the second, the understanding, the application, the rising into the C2, and the last two, the evaluating, creating into the C3. So this is our new domain, which we call as the Sampson taxonomy or the psychomotor domain. As we discussed earlier, that in psychomotor domain, the learning would be involve such activity in which we are doing something, we are working, we are using our skeletal muscles. So inshallah, we will discuss the psychomotor domain in the next session. Today we have two sessions, and in these two sessions we have discussed the cognitive domain, the learning objectives, and as well as the different levels of learning with examples of daily life as well as example from that medical sciences. So inshallah, we will meet again in the last session of today, which will be psychomotor domain, the Simpson taxonomy. Thank you so much to all of you.